trying to relate to that patient in a different place than what you're there for goes a long way in accomplishing that. You try to be empathetic as much as possible. You try to educate, that also helps. We try to make sure, oddly enough, that they get the education from you as opposed to Google. I had a patient just yesterday who came in shaking in his boots for a procedure we were about to do, and what's going on? What's wrong? Well, I looked it up and gave me a list of things that he thought that he should avoid eating, and I kind of looked at him and said, but you don't need to avoid any of that stuff with what we're doing today. From a relational standpoint, that goes a long way in kind of easing people's anxiety. But if that doesn't work and there's, there continues to be a level of anxiety that's very difficult to work with, then there's certainly nitrous oxide that we use, that we have available in the office. And even I can sedate patients medicinally up to a point. And that seems to work very well in conjunction with nitrous oxide and other things. So there's no reason for somebody to be surprised or uneasy when they're coming into the office. And even when they're coming for the procedure, this patient yesterday that came with the list, had 3 or 4 questions that were concerns to him. And of course, before we do anything, after saying hello, we said, do you have any questions about what we're going to do today? Let's be clear that you understand what I'm going to do and that I understand where your head is at. That's super important. And I don't want to surprise anybody ever.